What if the most common vaginal infection isn't caused by poor hygiene, but by too much of it? Today, we're breaking down bacterial vaginosis, what really causes it, how it's treated, and 6 evidence-based ways to lower your risk. What is bacterial vaginosis? Bacterial vaginosis, or BV, is the most common cause of abnormal vaginal discharge in reproductive age women. BV occurs when the normal vaginal ecosystem becomes unbalanced. Under healthy conditions, the vagina is dominated by lactobacillus bacteria, which produce lactic acid and keep the vaginal environment slightly acidic. This acidity helps prevent harmful bacteria from growing. When lactobacillus levels drop, other bacteria multiply more easily, and that shift leads to BV. BV is not considered a classic sexually transmitted infection, but sexual activity can increase the risk, especially with new or multiple partners. Why BV matters. In many cases, BV doesn't cause serious long-term problems. However, untreated BV has been associated with increased risk of pelvic infections, higher susceptibility to sexually transmitted infections, and pregnancy-related complications such as preterm birth. That's why recognizing and treating BV properly is important, even when symptoms are mild. Common symptoms. Here's an important fact. Up to 50% of people with BV have no symptoms at all. When symptoms do occur, they may include a strong fish-like vaginal odor, often more noticeable after sex, thin vaginal discharge, usually white, gray, or sometimes green, vaginal itching or irritation, burning during urination. Any discharge, odor, or irritation that's unusual for you should be evaluated because similar symptoms can be caused by yeast infections or sexually transmitted infections, which require different treatments. Evidence-based treatment. Bacterial vaginosis is treated with prescription antibiotics. The most commonly recommended options include metronidazole or clindamycin. These medications may be taken orally or applied inside the vagina, depending on the treatment plan. Treatment typically lasts 5 to 7 days. It's essential to complete the full course, even if symptoms improve early. Stopping treatment too soon increases the risk of recurrence. BV is known to recur frequently, sometimes within months. If BV occurs 4 or more times per year, longer-term suppressive therapy, often a vaginal antibiotic gel, may be recommended under medical supervision. During treatment, avoiding sexual activity until symptoms resolve helps improve effectiveness and reduce reinfection. 6 evidence-based ways to reduce BV risk. While BV can't always be prevented, research supports these practical steps. 1. Avoid douching. Douching disrupts the natural vaginal microbiome and significantly increases BV risk. 2. Skip scented products. Vaginal sprays, deodorants, and fragrance soaps alter vaginal pH and bacterial balance. 3. Practice safer sex. Using condoms reduces bacterial exchange that can trigger imbalance. 4. Limit multiple or new sexual partners. Frequent changes in partners are associated with higher BV recurrence. 5. Clean sex toys thoroughly. Improperly cleaned devices can transfer bacteria back into the vagina. 6. Use gentle hygiene habits. Wash only the external genital area with water or mild unscented soap and wipe front to back after using the toilet. Clear conclusion and call to action. Bacterial vaginosis is common, treatable, and often preventable, but only when it's understood correctly. If this video helped you, like the video, subscribe for weekly evidence-based health education, share your experience or questions in the comments. Your voice may help someone else. Thanks for watching, and I'll see you in the next video.